A very good evening, friends. Hope you all are safe and sound and at home in these challenging times. As you all might be seeing in the news and reports that the wave 2 of COVID cases is slowly easing up. But that does not mean that we should take our guards down. We should think about our family and loved ones. Follow all the protocols and try and stay at home as much as possible. You all are aware that COVID-19 is no simple virus. It is affecting not only the respiratory system, but even the heart and the brain. And it can unload a host of symptoms on your body. Doctors are saying that the most profound and the impactful ones are on the lungs. Lung damage is also one of the reasons for COVID severity and mortality rate. What I'm reading from news articles and journals is that a change in respiratory functioning or damage on the lungs wall can also lead to shortness of breath, respiratory distress, infection, and the much feared COVID fibrosis. I believe it is important to keep ourselves, our lung health in proper check so that in the long run, our health and vitals are in good shape. Now, seeing the importance of lung health in today's time, we could not think of a better session where we have experts in the field to share their knowledge on not just what causes respiratory health issues, but what can be the ways to tackle this through exercise or diet or good lifestyle change. Now, before I hand over the virtual stage to our experts, I would like to thank each one of you who attended our very first session on food and nutrition. And by chance, if you have missed it, then do log on to our Amway India official handle on YouTube and Facebook to catch that session. Also, as part of our Liv Nutrilite @360 initiative, we will have 2 more sessions. One on mental health on 13th of June, and next and final one will be on energy and strength, which will happen on 20th of June. So it's an action-packed module with a lot of tools to support you, like exciting offers, digital leaflet, and videos to talk about this initiative. Not just that, you all are aware that we have a vast variety of supplements that can help you not just in your journey to support immunity, but also to help your general health and well-being in these trying times. We at Amway Nutrilite are there to support you with supplements that support your lung health, immunity, energy needs, fatigue, stress, respiratory health, digestive health, liver health, heart health, and so much more. So be part of this informative yet educative sessions and gain newer insights to look after your health and nutrition. I would also like to take this opportunity to share my personal journey post I became COVID positive. I'm not sure how or where I picked the infection, but I was the only person in the family who was COVID positive, and thankfully rest of the family was not affected. My symptom was bouts of fever, unrelenting, between 101 and 102. And though I was taking the prescribed medicines, it was not receding. Post 11 days, I was advised hospitalization to control the events. And after 3 days of medication at hospital, things were in control. And I was discharged after 6 days post-observation with advice to continue with few support supplementation and medicine for next 7 days. Also advised post-COVID OPD on 25th day. Now on hindsight, I can say that outside of fever, I had no other symptom of breathlessness, sore throat, shortness of breath, etc. Though my fitness regime was somewhat compromised because of COVID for a few months, focus on healthy diet and supplementation played key role in my fight against COVID. And very interestingly, when I went for post-COVID OPD with a very renowned doctor and director of internal medicine of a well-known hospital in Gurgaon, after looking at all my clinical reports, he said that everything was within parameters. And guess what? He prescribed to facilitate post-COVID recovery Chyawanprash, protein, ashwagandha, and multivitamin. And I told the doctor that I work with Amway and have all these things. I feel proud that I work with an organization that believes in all the four pillars of health. And with all of you, I'm playing a small role to take the message of health and wellness to our communities. I would also like to mention that to get back into my best form, I'm taking support of one of our very promising platinum leader, Remy Paul. She is an amazing mentor and coach recommended by Ankur Gupta, our very senior leader and a friend of mine. And I must confess that I have this far been poor student, not following particular discipline, but through this video, I promised that I would be investing in myself and get back to my best form. That was about my personal experience and journey, and I'm thankful and grateful for all the best wishes that helped my recovery. So let's now kickstart this afternoon with a very informative session by Dr. Puneet Khanna, Head of Department and Consultant of Respiratory Medicine at Manipal Hospital, who will take us through the role of lung health in today's trying times and what are the ways in which we can take care of our respiratory issues. So over to you, Dr. Puneet Khanna.
Hi, I'm Dr. Puneet Khanna from Manipal Hospital, Dwarka. I'm Head of Pulmonology. We have recently witnessed a sharp surge in COVID cases, which we call a second wave of COVID. Now, there are many reasons for this second wave, and it was a very dangerous wave. No, there is no absolute understanding as of now or absolute answer for this, that why this wave happened. But there are a couple of factors that we have to keep in mind so that we can prevent the third wave from coming. The likely explanation of this second wave is that this wave happened because there was a different variant or multiple different variants of the COVID virus which were not existing in the population before. And not everybody was vaccinated, so the exposure was very high in a short span of time. So the number of cases went very, very high. And because the numbers were very high in a limited amount of time, the cases became very sick and the hospitals were all flooded with patients. Now, what are the measures which we can take to prevent this second wave to become a third wave, or prevent the mistakes that were committed during this wave? The first and foremost thing is that we have to understand that there is no replacement to prevention. If we can prevent ourselves from getting infected, then we can very well control this, and we can also prevent this from spreading to others. So the basic the precautions that we have to take is that unless it is absolutely essential, please avoid going outdoors. You should always maintain strict social distancing, maintain at least a distance of 6 feet from each other, even if you are going to a crowded place, which is unavoidable. Always wear a mask and if possible gloves, and always carry a hand sanitizer with you. Because if you can prevent infection from getting in or prevent the transmission of this infection, then obviously we can prevent this from the very beginning. Then it is very important that in addition to taking these precautions, you should always strive for good immunity by taking proper nutrition, proper rest, taking proper medications for your pre-existing disease. Also, those who have not been vaccinated yet should get vaccination done at the earliest possible time. Because if you are vaccinated, then you are likely to get a less severe infection or a very mild infection. And if this is a mild infection, then obviously the spread of this infection will also be very low. So I would suggest that if we take these measures, then we can to a very large extent prevent the third wave from coming. Now I'll talk about some effects of this particular virus that happens on lung, and in the next few minutes I'll be talking about what this virus causes, its adverse effects on the lung, and what happens during COVID infection when a person is infected. Whenever there is effect of COVID infection in the body, almost all organs are affected, but particularly lungs get infected the most, and these infections in the lung, they lead to moderate or severe pneumonia. So when there is a severe pneumonia, we have fall in the oxygen levels, we have problem of breathlessness and chest pain. These problems then lead to multi-organ diseases and multi-organ effects, and this eventually some people succumb with this. So what we have to do is to prevent ourselves from getting infection, because we don't want our body to be affected. Apart from the measures which I just enumerated, like wearing of mask and sanitizing your hands and following the cough etiquettes and sneeze etiquettes, like avoiding coughing using your hands or sneezing your hands. You should always use your elbow, or must carry some tissue with you that can be safely disposed. So apart from these measures, it is also very important for you or for anybody who's having any of the symptoms which are particular to COVID, like fever, breathlessness, or chest pain, or body ache or lethargy. And if they have suspicion of COVID, they should isolate themselves. The effect of isolation is very good. It's tremendous in many population. It has been seen that if people have been isolated early, then they are unable to transmit the infection to others, particularly the family members. Now I'll be talking about the short-term and long-term effects of COVID-19 on lungs and other organs of the body. Normally it says that a person who's been infected with COVID, they normally tend to recover within 2 to 6 weeks from COVID symptoms, and usually all their symptoms of cough and breathlessness, they decrease to a very large extent. However, there are some group of patients who continue to experience symptoms beyond 6 weeks. Now these patients are called long COVID syndrome patients, or patients who are suffering from prolonged COVID sequelae. While talking about these symptoms, the common symptoms that we see are symptoms related to lungs, related to heart, related to brain, and related to other organs. Talking about the long COVID syndrome, or when you encounter a patient who says that they have been sick for a while and after that they recovered from COVID, but again they started having problems like fever, body ache, and inability to concentrate, we call this as long COVID syndrome. So when I talk about lungs, the prolonged symptoms can remain like exacerbation of asthma, some chest pain, cough, breathlessness, exertional breathlessness. They find it difficult to do the kind of work they were doing before COVID. So all these symptoms, they can happen due to the effects on lungs. Then a very important symptom that we see in many patients who come to us after 6 weeks is their inability to concentrate, their habit of forgetting things, their inability to sleep well in the night. These are all neurological symptoms that can happen. We call it as brain fog. This normally happens because they have been exposed to long periods of low oxygen during their illness, and that takes some time to recover. A very important subset of patients have often reported post-traumatic stress syndrome, which basically means that after the stress of getting admitted to the hospital or being in the ICU, they experience difficulties in concentration, they feel irritable, they are easily frustrated, and there is lack of interest in things. Then there are other symptoms like they lose their appetite, but most of these symptoms recover very well after the patients recover from their long COVID syndrome. Similarly, there are patients who have cardiac problems after recovering from COVID. This can range from an increase in the heart rate, increase in the blood pressure, to a very common symptom of ghabrahat or restlessness. Now again, if you consult your physician or a cardiologist, they will probably prescribe you medications which can easily overcome these symptoms. So there is no need to get anxious or panicky about this symptom because they are very common symptoms. Some people do ask me that are there changes in the lung which are permanent because of this COVID, or what are the permanent lung function changes that can happen? Well, our experience in the first year have shown that almost all patients, majority of them, recover very well after COVID infection, and there is no permanent damage to lung because of COVID. And many patients, they are very disturbed about their CT values, damages that they see in their CT scans, and they ask me whether this damage is going to be permanent or it is going to be temporary. So we assure them that most of the changes that you see in CT are acute changes and they normally recover by 6 months. There is no need to repeat CT again and again. Many patients recover their lung functions completely by end of 6 months. However, there are certain patients who, particularly those who had very severe pneumonia or were on ventilator, they do go on to develop some lung fibrosis or some kind of asthma. So there are medications available for these patients, including rehabilitation and breathing exercises, and we help them accordingly as per the case to recover their lung functions by 4 to 6 months. But it is very important to understand that there is no need to panic because of this, because many patients recover naturally also with COVID. Now, again, a question that is asked, very commonly is that what can an infected person do to regain his lung function? So, like I said, the basic principle, apart from the medicines, which obviously a physician can prescribe, is to maintain a very good lung health by improving your diet, improving your breathing capacity, improving your lung function by doing some exercises, pranayama and yoga, and also having a very good quality sleep at the night, minimum of 8 hours of sleep. All these things can help you recover your lung function apart from the medications that can be prescribed. So, to summarize, if we need to give tips to healthy individuals how to improve their overall health so that they are prevented from getting a repeat infection or some kind of morbidity because of this COVID illness, the best and foremost thing, like I said, are the steps to improve your immunity. So to have a proper diet, do some brisk regular exercises, restricting yourself from public places, and then practice some very, very simple techniques like practice slow and deep breathing while lying on your back or while lying supine. Do some regular yoga and pranayama at least 30 minutes per day. Then it is very important to have a stress-free life and avoid getting into stressful situations again and again. There are certain humming exercises that are prescribed or breathing exercises that can help you in regaining your lung functions. In patients who have got asthma or COPD, can do pursed lip breathing where you whistle like this slowly every 15 and 20 minutes, but after taking a deep inhale breath. So that also improves your lung function by taking good deep breath, holding your breath for 10 seconds and then slowly releasing it by pursed lip breathing. Any good physiotherapist can explain you how to do it and how to approach this. Then we go to what a stepwise guide can be for these breathing exercises. So like I said, deep breathing while on your back, deep breathing while on your stomach, and deep breathing while sitting. All these can help you in regaining your lung function by doing some gentle maneuvers that do not require you to go outside. You can easily do those maneuvers at home also. Now, what are the dietary modifications that can help us in preventing the lung functions? Among the diet, first and foremost thing is that whatever diet you take has to be a nutritious diet. Cut down on unnecessary calories and avoid taking food that can incite cough like spices or chili or very cold things or very hot things. Needless to say that you should avoid eating outside during these pandemic times as much as possible, or wherever you eat, it should be a hygienic food. Avoid taking aerated drinks and junk food because they are known to cause worsening of your blood sugars and worsening of calories, and they can make you prone for infections. You should at least take 2 to 3 servings of fruits per day like oranges, sweet lime, apple, guava and kiwis because they contain good amount of vitamin C and carotenoids and antioxidants, and they can help you increase hydration of the body and overcome the harmful effect of medications or toxins in the body. Also, at this time, I advise all my patients not to go for aggressive weight loss regime because if you go on a weight loss diet, your immunity is bound to go down and that can make you prone to get infections. Apart from this, it is very, very essential that nobody should smoke, because smoking is known to decrease your lung function, it is known to decrease your immunity. Avoid taking excessive alcohol and completely stop smoking, because it is harmful not only for the person but also for people around him. And active and passive smoking is going to even further deteriorate your lung functions. Along with this, high protein, high vitamin diet is naturally going to improve your immunity. Now, there are people who have asked me that whether, even if they don't have a poor lung function, should they use a spirometer at home, particularly after they have recovered from COVID. Now, spirometry is a very simple exercise. It is almost similar to a breathing exercise where you deeply inhale and exhale, but spirometer makes it more easy for people to do it, and it doesn't require any major instructions also. So it is very important that somebody who knows how to use a spirometer can learn from his physiotherapist and then use it accordingly. It is a very simple device. You just need to sit straight on a chair and inhale and exhale as per the instructions to lift those balls. Now, it has been shown that these spirometry and other maneuvers have helped people with chronic lung disease like COPD and asthma, but I'm sure it also happens to improve the lung functions in COVID patients. So at the end, I'll just summarize that COVID is all about managing your immunity, managing your symptoms well, recovering well in a stress-free environment, and have a very, very positive attitude so that you can overcome this disease and its sequelae very well. And many patients, almost majority of patients, they recover very well after COVID, and very few people unfortunately lose their life if the disease is severe or have a permanent disability. So all the best, and just take care of your health. Thank you.
Namaskar, I am Dr. Rumpa, MBBS and MD in pathology, and currently working as an associate professor in a medical college close to Lucknow. I look after the diagnostic part of a disease, and from last 1 year, I am closely associated with COVID patients, as my hospital is a COVID hospital since March 2020. My husband is an ENT surgeon, and he runs his own hospital and hence comes across infected patients on a regular basis. Last year, when COVID came, there was a panic situation among all of us because we didn't know much about the disease, its management, and we didn't have a vaccine. I was posted in COVID laboratory and I had to look after my 6-year-old daughter, also 80+ father-in-law in my house. So I was a little stressed. So I started reading articles from different journals, keeping in mind that there must be some natural resources we have and that can be used to create natural defense against this deadly virus. I was following all the protocols and safety guidelines regarding COVID, but I knew that one day I or my family may face this deadly virus. I came across different articles related to impact of nutrition and physical activity on COVID. After reading all this, I was a little relaxed now because me and my family, we do regular physical activity, we take adequate rest, we take good nutritious diet with home cooked food, and we also take food supplements to fulfill the nutritional gap. We were taking Nutrilite supplements like multivitamin, multimineral daily, salmon omega, all-plant protein, and also excess protein since many years. We also keep our daily protein intake between 1 to 1.5 gram per kg body weight. We also take vitamin C and multi-carotene because vitamin C and vitamin A has important role in epithelial integrity, and our respiratory tract, which is lined by epithelium, and it has an extensive surface and It is directly exposed to the external environment. We were also taking Calmette D plus because vitamin D has an immunomodulatory function, and vitamin D plays an important role in lung health. Because many studies are there where it is seen that when a person is deficient in vitamin D, he may develop different lung related issues like asthma or chronic obstructive pulmonary disease, or these person they may have decreased vital capacity. We were also taking Vasica mollitis cerasa to support our respiratory immunity and also to support our airway. Prior to the second wave, when the cases started to increase, I took a course of echinacea in the month of March 2021 to improve my natural resistance and respiratory immunity, as echinacea helps to improve phagocytic function of immune cells and also has an anti-inflammatory wound healing property. In the month of April 2021, my husband and I caught the infection. He was the first one to be affected, but his symptoms were only loss of smell and mild uneasiness. After him, I caught the infection from my hospital, and my reports came out to be positive with a very high viral load. But I had only throat irritation and nasal congestion and no other symptoms. Both me and my husband were isolated, followed all the advice of our physician and taking good nutrition, plenty of fluid orally, along with all the prescribed medicines. When a person is infected, there is an increased need of dietary amino acid, fatty acid, vitamins and minerals, because immune cells they proliferate this time and the body requires more energy to overcome the infection. In COVID, we had a loss of taste also, and it was not possible for us to take more food. So we doubled the dose of all the supplements. We were physically active all the time in the form of completing 10,000 steps in a day and also taking adequate amount of rest, and we were also regularly monitoring our temperature and oxygen saturation. We didn't have fever and our oxygen saturation was normal all the time. Both of us recovered well without having any adverse events. My husband came out to be negative after 7 days and I joined my hospital after 10 days. We took steam inhalation that time to ease the respiratory symptoms. I also did breathing exercise while walking inside the room, as breathing exercise helps to clear the mucus and keeps the airway open, improves oxygenation and helps in better sleep and relieves from anxiety. Many of our friends and relatives also caught the infection this time. My brother-in-law had a severe course of disease as he has diabetes and his oxygen saturation fell below 80 with severe pneumonia and markedly deranged blood parameters like very high C-reactive protein, interleukin-6, D-dimer and very high neutrophilic leukocytosis. My husband went to his place and managed him at home with oxygen support in guidance of his treating doctor. In his case, along with all the other prescribed medicine, we added Nutrilite supplements like daily, salmon omega, vitamin C cherry plus, echinacea, Vasica mollitis cerasa, ashwagandha, Calmette D plus and multicarotene in a double dose. He was on insulin as his blood sugar level was very high as a result of intravenous administration of corticosteroid, and along with insulin, we also gave him madhunashini. He followed a high protein diet as prescribed by his treating doctor, and we gave him a lot of all plant protein powder along with home cooked food. We gave him all plant protein powder in form of soup and also mixed with starch or juices. He is fine now and he showed a quicker recovery. We suggested Nutrilite supplements to many of our relatives and friends. We suggested coenzyme Q10 especially to some of our relatives and friends with severe COVID, as many reports of COVID-associated cardiac complication has been reported in second wave. And fortunately, none of them developed any adverse cardiac event. COVID-19 is a virus and it is a systemic hyperinflammatory vascular disease, and lungs are the most affected organ. The immune cells infiltrate the lungs and initiate an excessive inflammatory reaction, leading to vascular leakage and accumulation of fluid in the alveoli. The oxygenation becomes compromised and there is severe lung injury and respiratory failure. Because of this pro-oxidant, pro-inflammatory state, there is a need for nutrients that target oxidative stress and inflammation. Vitamin A, vitamin B6, vitamin B12, folate, vitamin C, D, E, and some minerals like zinc, copper, and selenium, and essential fatty acid like eicosapentaenoic acid and docosahexaenoic acid plays a role here. To conclude, I just want to say that focus on your health when you are healthy and disease-free, because we can't build a better immunity and better health in one day. Don't panic, take balanced nutrition, take proper rest, do any type of physical activity, and it improves the immunity, and it's especially beneficial for your respiratory health, and it improves your vital capacity. Maintain your ideal body weight and body fat percentage, because obesity and lifestyle diseases are directly associated with COVID-related adverse complications. Follow good hygiene, follow all the government guidelines, monitor your temperature and oxygen saturation regularly if infected, and follow the advice of your doctor. I am vaccinated, but here I want to emphasize that we need a good nutritional support and regular moderate physical activity and proper rest to enhance the vaccine response and proper functioning of our immune system. So that's all from my side today. Thank you for listening me. Stay safe, stay active, stay fit, take good nutrition. Thank you.
Hello everyone, my name is Dr. Shyam Ramakrishnan. I'm a PhD in biochemistry from University of Texas Medical Branch and a postdoctoral fellow from Harvard Medical School. I've been with Amway for 10 years and I lead the innovation and science function at Amway India. Today I will attempt to communicate some interesting nuggets of information on lung health and immunity. While the focus on today's talk will be on respiratory health, I will also spend some time on products which are essential to maintain a healthy immune system. But before I go deeper into these subjects, I would like to give you a brief introduction to Amway's Innovation and Science. Amway's Innovation and Science is the research and development wing of Amway. Our team consists of formulators, physicians, engineers, nutritionists, all botanists, you name it, we have all kinds of scientists, regulatory scientists. So all of you should feel very confident that the products you consume are developed with utmost care by this amazing, fantastic team here in India, using global insights, wisdom from Indian traditional medicine, and of course with their own background. With that introduction, let's dive directly into the topic of lung health and immunity. So lungs play a very vital role in keeping us strong and healthy. But we seldom give importance to the lungs as compared to other vital organs. It's not until we experience breathing problems that we take notice, right? It's essential to take care of respiratory and lung health. If the lung is unhealthy, affected, it impacts the overall quality of our life. Now, did you know that our lungs take in about 10,000 liters of air every day? Breathing feeds oxygen into every cell of the body. Without sufficient oxygen, we are more prone to health problems. But experts say that everyday breathing is insufficient. We are not utilizing our lungs fully. In fact, we use perhaps 50% of our lung capacity. So like the rest of the body, lungs too thrive in movement and activity. Now, having said that, let's talk about some lung functions. We all know from our basic sciences that lungs have two main functions: bring in oxygen into the body and exhale the carbon dioxide. Now, alveoli are these tiny air sacs in the lungs which exchange CO2 and oxygen. By the way, did you know that we have 300 million air sacs in our lungs? And these 300 million air sacs, these globules, these balls, can expand, and if the 300 million air sacs expand, it can cover an entire football field. That's how nature has been very smart in optimizing the lung so that we can have the best compact lung function possible. In addition to these basic functions, the respiratory system, which consists of lung and airway, performs many other critical functions. The first is a physical barrier. The physical barrier, which basically forms a barrier to prevent the bloodborne substances from entering into the lungs, and as a chemical barrier which is of vital importance in blood coagulation. Now, the airway lining has cilia or hair-like structures that helps trap the dust and microbes and foreign particles. So the respiratory tract, including lungs, has a mucus blanket which forms the first line of defense against inhaled substances, dust, microbes, and other particulate matters. Immune function within the lung is mediated by specialty immunity cells called pulmonary alveolar macrophages, or PAM. It's a nice name. These immunity cells perhaps is one of the first and most critical line of defense against microbial invasion in the lower airways. These immunity cells are just hungry for disease-causing microbes, and when they see these enemies, they just start chomping on them, eating them out. And finally, lung has one major function to cleanse and remove harmful substances that we inhale into our body. So for lungs to perform all the above functions at their optimal level, the airways needs to be open during inhalation and exhalation and need to be free from inflammation, which is basically swelling and accumulation of abnormal amounts of mucus. So there are many factors that can impact lung health. For example, environmental factors like tobacco, exposure to low air pollution, inhaling secondhand smoke. Second, prolonged sedentary lifestyle with minimal physical exercise. Third, people can also have affected by bacteria or viruses. And fourth, lung is also very vulnerable to allergic substances. Now, let's talk about what can keep our lungs healthy. It's no secret that a well-balanced diet and exercise keeps the mind and body strong. However, eating the right foods and nutrients can give energy to stay active throughout the day and support our immune system and support our respiratory health. The right nutrients in our diet can support our lung health and help minimize underlying lung conditions too. So there are three components to keep our lungs healthy. One is exercises, second is consuming nutritious food, and finally taking high quality supplements consisting of time-tested herbs and key nutrients. But however, before we go further, I just want to caution, please discuss with your physician, yoga teacher, physiotherapist, or nutritionist if you have any underlying condition before following the recommendations. So coming to the first component, exercise. Exercises including pranayama as well as physical exercise. When we look back at our ancient gurus, they knew the secret of maintaining healthy lungs. Now, pranayama is one of the gifts from our ancient gurus. It is a practice of breath control in yoga. It consists of synchronizing the breath and movement between asanas, but it's also a distinct breathing exercise on its own. In fact, a comprehensive study of 16 clinical studies consisting of 1900 subjects showed that breathing exercises have some positive effects on quality of life, hyperventilation symptoms, and lung function. It also supplies body with oxygen while removing the toxins. This is meant to provide a healing physiological benefits. According to research, pranayama can promote relaxation, mindfulness. It is also proven to support multiple aspects of physical health, including blood pressure and brain function. So pranayama makes efficient use of abdominal and diaphragmatic muscles and improves the respiratory health. It strengthens the respiratory musculature, due to which the chest and lungs deflate and inflate to the fullest possible extent and strengthen the rib muscles. In our last session, you will also hear a yoga instructor who is going to take us through various exercises. Now, physical exercise, on the other hand, is also one of the best workouts for our lungs. The muscles between our ribs expand and contract, and the air sacs inside our lungs quickly to exchange oxygen with carbon dioxide. The more we exercise, the more efficient our lungs become. So when I say physical exercise, it doesn't mean running on a treadmill. It is as simple as walking to improve our physical overall conditioning. A schedule, for example, could look like 5 minutes 5 times a day. First week 1, week 2, 10 minutes 3 times a day, week 3, 15 minutes 2 times a day. So you just keep on increasing the walking, this time and the speed, and quickly you will reach up to the level where your lungs are really breathing efficiently. But one caution, stop all exercise immediately if you get chest pain, palpitation, exhaustion, dizziness, lightheadedness. Contact a physician promptly if any of these symptoms persist. But finally, I should say one exercise which I really love is laughing out loud. The laughing yoga you must have heard is one of my favorite exercises, and I practice it as much as I can. Laughing out loud, when we laugh, what happens is our diaphragm, chest and abdominal muscle tighten. Right? This makes our lung work harder by forcing stale air out and allowing deeper the CO2 to expel out and more oxygen to come in. That is why, according to the Canadian Lung Association, laughter makes our exhalations more effective. So the second most important component to maintain lung health is to eat a nutritionally balanced and varied diet. Most people are surprised to learn that the food they eat may help in the respiratory function. Our body, in fact, uses food as fuel for all of its activities. The right mix of nutrients in our diet can help our respiratory function. No single food, in fact, will supply all the nutrients we need. A healthy diet has a variety of fruits and variety of vegetables and variety of grains, right? And this is as per the American Lung Association. So how does food help in our respiratory health? The process of changing food to fuel in the body is called metabolism. Now, oxygen in food are the raw materials in the process, and energy and carbon dioxide are the finished products. The energy we have every day is from the food and oxygen, which is burned in our body. Right? Carbon dioxide is the waste product which we exhale. So did you know that the metabolism of carbohydrates produces the most carbon dioxide for oxygen used? And actually the metabolism of fat uses the least. Therefore, eating a diet of fewer carbohydrates and a little bit more fat can help with respiratory function. So when we talk about food and nutrition, as I said, it has to be varied diet, varied kind of phytonutrients coming from the fruits and vegetables. There are two of the phytonutrients I want to mention today, actually three. One of them is quercetin, second is lycopene, and third is licorice. And these are parts of our food. Quercetin is found in various fruits like apples and vegetables, and it plays a very protective role for respiratory health. Similarly, other nutrient is lycopene, found in tomatoes, in papayas, in guavas, and watermelon, and it has been known to be effective in reducing inflammation. So 4 to 5 servings of fruits and vegetables are very important to utilize this protective nature. And one last product is licorice or yashtimadu, and it contains the flavonoids which has been known to be effective to attenuate inflammation and ameliorate remodeling and structural changes of the airways. So now let's talk about some of the supplements I personally believe in. Amway Innovation in Science has long recognized the similarity of Nutrilite philosophy to traditional wisdom, especially Indian wisdom. Our scientists have blended the philosophies, resulting in wholesome approach to nutrition, inspired very much by nature. A harmonious amalgamation of traditional wisdom and modern science has led to the genesis of our Nutrilite traditional herb range of products. So two of the products I'm going to talk about from that range are the Nutrilite Tulsi and Nutrilite Vasaka, Muleti and Surasa. Now both are known to support this immunity and respiratory health very strongly. I'm sure many of us have heard our elders asking us to eat few leaves of Tulsi every day in the morning on empty stomach or when we have running nose. Yes, Tulsi is a well-known rasayana in Ayurveda known as the queen of herbs, used for its medicinal properties. It is used for managing respiratory discomfort and to strengthen immunity and support symptomatic relief in cold and cough. I'm sure you all know Nutrilite Tulsi is made with an extract of organically sourced DNA authenticated Tulsi leaves. The extracts are standardized to active component of 2% ursolic acid. So, and one tablet is equivalent to an extract from 100 dried organic tulsi leaves. The second product I take is Nutrilite, Basaka, Mulethi and Surasa. It is a unique blend of 3 traditional herbs in suitable ratios. So this has been developed internally with a strong understanding of modern science and traditional wisdom, and we have also assessed it in a proof of concept clinical study to establish safety and directional benefit. Vasaka has been most frequently used for managing respiratory complaints. It also helps in clearing the secretion and thinning of the sticky sputum in the respiratory tract and easy expulsion of the phlegm. It is known as a bronchodilator, helping to make breathing easier by relaxing the smooth muscles in the lower respiratory tract and whitening the airways. Mulethi, as I mentioned before, also is a very important herb and traditionally used to maintain respiratory tract health by reducing throat irritation and cough. It is also a potent antioxidant and free radical scavenger. And finally, Turasa or Tulsi is, as discussed earlier, it is one of the most important immunomodulator and helps in respiratory relief. Here, another formulation which is known to help immunity, which in turns help respiratory health, is a Nutrilite Echinacea Citrus Concentrate Plus. Nutrilite Echinacea contains the power of 3 blend of Echinacea purpurea herb, which from leaves and stem of the plant, Echinacea purpurea root extract, and finally Echinacea angustifolia root extract. Now, in addition, it contains a trans multiflavonoid from 3 different fruits: grapefruit, royal mandarin, and lemon. Now, did you know that Echinacea is grown in our own Trout Lake farm and it is organically grown? Studies have shown the antioxidant potential of the citrus bioflavonoids also against oxidative stress and to prevent further inflammation and strengthen immunity. Our next product I want to talk to you very briefly is our Nutrilite Concentrated Fruits and Vegetables. This product is extremely rich in various flavonoids which are found in fruits and vegetables. Flavonoids like quercetin and lycopene are known to maintain immunity and healthy lungs. But I will not go into any other details on this product other than the fact that a daily serving of Nutrilite Concentrated Fruit and Vegetables provides a broad range of phytonutrients equivalent to 10 servings of fruit and vegetables. Now, next product is Chyawanprash by Nutrilite. As we had discussed earlier, our Chyawanprash, in one of the earlier sessions, Chyawanprash is one of the most well-known rasayana adaptogen, and it's also known to balance dosha. Here is my bottle of Chyawanprash. Chyawanprash is known to support respiratory physiology in good health, and a regular intake of Chyawanprash strengthens immunity and functioning in the respiratory system. The last, perhaps one of the most important product which I want to highlight is the Nutrilite Vitamin C Cherry Plus, which is meant only for adults who have a weakened immunity. We had discussed this product in detail in the last session by Dr. Palani. Hence, I will touch upon very briefly on one of the important aspects in terms of respiratory health, in addition to its role in immune health. As researchers, we are always uncovering new functions of vitamin C. There are so many studies on vitamin C and lung that it would take me another 1 hour to really walk through on the lung aspect of vitamin C. So what researchers have found is that the transporters, or let's say trucks which carry the vitamin C, are present in the respiratory tract. And why do you think these transporters are present in the respiratory tract? Because these transporters are very important to carry the vitamin C into the lungs, in the respiratory system, to support the oxidative stress the lung is undergoing. And these cells in the lungs are called the metabolically active cells, meaning it works very hard. And when something works very hard, it also creates certain oxidative stress radicals, oxidative radicals, and it has to be taken away from the body. Vitamin C plays a role. So one other point I want to make is vitamin C is present heavily in the PAM. If you remember the PAM, it is pulmonary alveolar macrophages. It is present at approximately 30 times the level in plasma, just showing how important it is for the lung health. To summarize, as all of us know, thousands of researchers, scientists, pulmonologists are working in the globe to find ways to address various lung issues in these challenging times. They are also working to help people combat the unpleasant sequelae of symptoms to restore health. Amway, as a responsible health and wellness organization, is focused on delivering the best supplements which exercise and food helps us maintain a strong respiratory health and even stronger immunity. Thank you and have a great day.
Thank you everyone for being a part of our second session of Liv Nutrilite at 360 that was focused on immune and respiratory health, where each of our experts spoke about their experiences and their knowledge around the topic during these challenging times. In this session, our in-house experts also told us the supplements that can support our immune and respiratory health as well. So, to help you take this information forward, we'll be launching an exclusive offer for you and your family, which is focused on the products as explained by our experts during the session. Please get ready to purchase our immune and respiratory healthcare offer, which will be available from 7th June 10 am onwards. So buy Nutrilite Vasaka Muleti and Sursa, Chawanprash by Nutrilite, Nutrilite Tulsi, Nutrilite Echinacea Citrus Concentrate Plus, Nutrilite Concentrated Fruits and Vegetables, and Nutrilite Vitamin C Cherry Plus, and get 5% off on buyer's price. Now, isn't this an exciting offer? Hurry, as the offer will be valid till stocks last. Also friends, last few days left for the foundational care offer, so hurry. Also would like to remind you all that we will be coming back with our third session focused on mental health with our experts on the 13th